Welcome. This is the embryology, a case study. A 26-year-old woman, pregnant, severe edenophagia, and complex medical and social history. Mrs. Taylor, a 26-year-old pregnant woman at approximately 5-month gestation, present with severe edenophagia. A rapid strep test confirms streptococcal pharyngitis and is prescribed amoxicillin. The patient reported a history of homeless, past methamphetamine addiction, and limited parenteral care. 26-year-old pregnant woman with severe edenophagia and a complex medical history. Severe and confirmed streptococcal pharyngitis, homeless, past methamphetamine use. Risk of fetal anomalies due to maternal and parenteral factor, nutritional deficiencies and stress, history of homeless and past methamphetamine use. This is homeless. She is homeless. She is past substance use or child with cleft palate. She has previously give birth for a cleft palated fetus, congenital anomalies, heart anomalies or cleft palate, growth restriction, parenteral birth. This is the risk she faced. The father, age 55, family history of cleft palate, genetic mutation and congenital anomalies. Fetal schedule for the diagnosis: fetal ultrasound, initial comprehensive parenteral care, provide housing and mental health support, offer genetic counseling, integrated care for better maternal and fetal health outcome. Mrs. Taylor history: homeless for a past year, living in shelters, former methamphetamine addiction, reported abstinent post treatment, one previous pregnancy resulting in a child with bilateral cleft palate, now in the care of maternal grandparents. Current pregnancy fathered by 55-year-old man. This is the father of the child. Why the current clinical concerns? Why might a fetal ultrasound be warranted? Assist fetal growth and development due to lack of parenteral care, screening for congenital anomalies, cleft palate, cardiac defect, evaluate for complication related to possible teratogenic exposure, methamphetamine used during early pregnancy. Concern about maternal health concern, nutritional deficiencies due to homeless, risk of untreated infection or condition affecting pregnancy, psychological stress or lack of consistent medical oversight. History of substance use may pose risk of fetal development. Potential impact on fetal health: potential risk to the fetus, increased risk of congenital anomalies, cleft palate, neural tube defects, growth restriction or preterm birth due to poor maternal health, long-term neurodevelopment, concern from potential early exposure or maternal stress. Relevance of parental age and family history: advances parental age 55 years increase the risk of de novo genital mutations or non-syndromic anomalies. Family history of cleft palate raise the possibility of genetic predisposition or environmental factor contributing to the risk. Proposed intervention: immediate scheduling of a fetal ultrasound for anomalies comprehensive parental care initiation, including nutritional support and infection monitoring, genetic counseling to assess risk factor related to family history and parental age, psychosocial support for housing, maternal health, and addiction recovery. This case highlights the importance of integrating medical, social, psychological care to optimize outcome for both mother and fetus. Early interventions and continuous support can mitigate risk and address underlying health parties. Explain the case as in your opinion. This case presents a complex blend of medical, psychological, and social factors that require a holistic and multidisciplinary approach. Below is an expert analysis of the situation, the clinical presentation, and the immediate management. The patient, we revised the case. As we mentioned before, this patient, Mrs. Taylor, is 26-year-old pregnant woman at approximately 5 months gestation, present with severe odonophagia confirmed to be due to streptococcal pharyngitis via a rapid strep test. Amoxicillin is an appropriate first-line treatment for streptococcal pharyngitis during pregnancy as it's safe and effective. Substance use, GW report a history of crystal methamphetamine addiction with abstinence following inpatient treatment over a year ago. Methamphetamine use earlier in pregnancy can't be ruled out, especially given her lack of medical care and unstable housing during this period. Methamphetamine exposure during pregnancy is associated with risks such as intrauterine growth restriction, preterm labor, placental abruption, neurodevelopment deficits in the fetus, nutritional deficiencies, and the general health. Prolonged homeless contribute to inadequate nutrition, potential deficiencies, folic acid, iron, critical for fetal development. Limited access to medical care raise concern about undiagnosed infections or medical conditions such as gestational diabetes or hypertension. Psychosocial stress, chronic stress from homeless and social instability can increase risk of adverse pregnancy outcome, including preterm birth and low birth weight. The congenital anomalies, the patient history of child born with bilateral cleft palate necessitate vigilance for recurrent congenital anomalies. While cleft palate may be sporadic, it can also have genetic or environmental etiologies such as teratogenic exposure, methamphetamine, or malnutrition during early pregnancy. Advanced parental age 55 years increase the risk of de novo genetic mutation, which could contribute to anomalies or symptoms in fetus. Delayed parental care. This Mrs. Taylor first reported medical consultation during her pregnancy, meaning she likely has not undergone a routine parental screening such as ultrasound or blood test for chromosomal abnormalities or infections, syphilis or HIV. Potential intrauterine growth restrictions, a combined impact of poor maternal health, potential substance exposure, and social stressor highlights the risk of intrauterine growth restriction, which require immediate evaluation via a fetal ultrasound. Significance of the family history and parental age. Family history of cleft palate is raised suspicion of genetic predisposition or environmental teratogens. Advanced parental age. The father age is a notable risk factor. Advanced parental age has been linked to increased risk of disorders such as autism and schizophrenia. Recommended intervention, fetal ultrasound, comprehensive fetal care, and psychosocial and housing support, congenital counseling, and substance use monitoring. Conclusion: Mrs. Taylor case underscore the interplay of medical, psychosocial, environmental factor in high-risk pregnancies. Early and aggressive intervention can significantly mitigate risk to both maternal and fetal health. A multidisciplinary approach include obstetric, genetics, social services, and the mental health is essential to optimize outcomes for growth and her unborn child.